Hi, I am Dr. Mike Totola, and you are watching the Case of the Week, brought to you by 38 Smiles Digital Dental, the home of 3-day crowns. And while this case is not a 3-day crown because it's an anterior case, it's a very interesting case we're going to take a look at nonetheless. Tooth number 7 is a natural tooth. Tooth number 8 for the patient, and the doctor wants us to treat teeth 7 through 10. So you can see tooth number 8 is a crown, because it's nice and bulky like a lot of crowns are. Tooth 9 is a natural tooth that the patient has worn down. And tooth number 10 is an unnatural tooth. Well, it's natural tooth, but it's so far rotated. Look, it's got an abfraction lesion on the distal. You never see that before, but that's because the distal is now turned out towards the buccal. And so the doctor and the patient are interested in doing something with 7 through 10. You can see nice prominence of the canines, and the bicuspids look good. So here is the DWAX from 38 Smiles Digital Dental for 7 through 10. And the patient wanted to do this as non-prep as possible. And so after the DWAX, you can see the stent that the laboratory made. And these are great because this is a nice, accurate way to be able to transfer the trial smile to the patient's mouth, let them test drive it a little bit. They get the chance to see it in the mirror. They also get the chance to go home. And in this case, it was a male patient who wanted to see if his wife would like it. Duh, of course his wife is going to like it. That works a lot better in the opposite direction when it's a woman wanting to go home and see if the husband's willing to invest in the smile. And by filling this with a bisacryl material like Luxatemp, you can then put it onto the patient's teeth. Of course, it's not 100% accurate because we haven't done any preparation, but you can see as it snaps on here to the model that we have space to be able to show the patient what it's going to look like. Because we want to do some of the teeth non-prep, no prep, we can end up with something that can be a little bulky. But if you're doing 7 through 10 and you've got good presence of the cuspids there, it's going to look really nice, as you can see it does on the DWAX here. So the patient went home, and of course his wife said, yes, please go forward with the treatment. And so this is a good example of how that stent can be very effective when you're putting in the patient's mouth so they can see what the final restorations are going to actually look like. And here are the final restorations on the working model. So tooth number 7 got a no prep veneer. Tooth number 8 got a new crown. Tooth number 9 got a no prep veneer. And tooth number 10 got a crown because, as you'll remember, it was super rotated with that distal edge kicked all the way out to the facial. So this is, in reality, what most restorative cases look like. It's not that often that you get to do all the teeth as no prep, but if you can do half the teeth as no prep, that's more conservative. So just to see again what the before looked like, we pop off the stent here, and you get an opportunity to see what a big difference that is for the patient going from the before to that after. And of course, you have a much higher chance of case acceptance if the patient is actually able to see this aesthetic result in their mouth before they start treatment.